Ladies and gentlemen, please pardon the AC that you hear in the background. It is 95 degrees in my state. And yeah, you can really feel it too, especially when you walk away from the air conditioning. So, this is a story that came out on NPR July 29th, 2019. Now, meth is like another epidemic that's going on in the US. So now they're seeing seizures of methamphetamines are surging in the US. So, we even have in my town, you can go down some streets and you'll see gaps in between the houses. That's a house that blew up. We had a few around here that blew up. So, methamphetamines, an illegal drug that sends the body into overdrive, is surging through the United States. Federal drug data provided exclusively to NPR shows seizures of meth by authorities have spiked, rising 142%. Wow. Wow. Between 2017 and 2018. Seizures indicate increasing trafficking in these drugs, says John Adey, Public Health Coordinator for the Federal Government National Emerging Threats Initiative, part of the High Intensity Drug Trafficking Area Program. So if seizures have more than doubled, it probably means more than double trafficking in methamphetamines. And with that go additional deaths. Overdose deaths involving meth and other psychostimulants did rise last year by 21% to 12,987 from 10,749 in 2017. According to provisional data from the Center for Disease Control and Prevention, deaths from cocaine and fentanyl were up too. I was reading some of the people that buy cocaine, they have no idea that fentanyl is laced in it in many of the cases. They had a big problem in New York with people dying, and they had no idea fentanyl was cut into the cocaine. But overdose deaths dropped overall because of a decline in a number of fatalities tied to pain pills. So, let's see. Seizures of methamphetamine spiked in 2018. Oh, yeah. You can see it in this chart from 2011 to 2018. Yeah, it went up every single year. Yeah, that is a hell of a spike when you look at 2018 in comparison to all of the other years. Okay. Interesting. For decades, meth has been associated with working class Americans trying to hold down two or more jobs and has been popular in some gay communities, but it hasn't been widely available in every region of the country. Now that's changing too. Seizures of meth are up, sometimes dramatically, in pockets of nearly every state in the U.S. based on data collected in 32 high intensity drug trafficking areas. I'm not surprised about that. I'm not surprised about that at all. It's going to rise. You know, these agencies, these government agencies, they haven't done a thing to stop the flow of drugs coming into this country. So the fact that meth trafficking is on the rise, not surprised. Not surprised at all. Okay, we're going to listen to this audio from NPR here. All right.
Methamphetamine has surged across the U.S. Federal data given exclusively to NPR show law enforcement seizures of meth more than doubled between 2017 and 2018. Martha Biebinger of member station WBUR in Boston reports on the growing problem of meth use.
There are many paths to meth. Mike Leslie, who's 37, found his way to meth after more than 20 years of drug use that started with weed, progressed to cocaine, and then opioids, pain pills, heroin, and fentanyl. About a year ago, Leslie had stopped using fentanyl, but was struggling against the urge to get high when he ran into an old acquaintance from the streets in Boston.
You know, he was selling meth, and it was basically the one thing that out there that I hadn't tried that was now readily available, and so I tried it.
Leslie realized right away why meth hooks people who are already using drugs. It's relatively cheap. One hit keeps you high and awake for days as compared to fentanyl, which wears off every few hours. And many people think meth is safer.
I knew if I went back to using fentanyl, I would likely overdose and die. And this was basically coke or crack times 50.
A powerful high that wrecked Leslie's life. He'd kept working years back while on heroin, but 4 months after his first injection of meth, Leslie had lost his job, dropped out of graduate school, and was sleeping on the floor of a train station.
As soon as I tried it, I was no longer functioning. It was all about the meth.
Easy access to meth is new for Boston and many regions of the country, but no longer unusual. A federal program that monitors drug seizures in 32 so-called high-intensity drug trafficking areas, or HIDAs, shows meth rising in virtually every one. John Eady, who tracks emerging drug threats through the HIDA network, says the sharp increase in seizures signals a major, rapidly developing problem.
The reason we're so concerned is that as seizures go up, the supply in the streets go up equivalently, and with that go deaths.
All stimulants are on the rise. Meth rates are the highest, but cocaine is up too. And doctors are prescribing more stimulant medications, such as those used to treat ADHD. Looking at these combined increases, Eady sees a stimulant epidemic entwined with the opioid crisis.
We're seeing almost as many people now starting up methamphetamines and cocaine and prescription stimulants as are abusing the opioids. So the problem is getting worse at the moment, and it's more complicated to deal with.
That's not news to Bradley Osgood, the chief of police in Concord, New Hampshire.
Methamphetamine just presents a whole new issue for us, and our officers are getting hurt. We've had concussions, we've had broken hands.
While trying to pull someone who resists out of traffic, for example. Osgood says calls to revive someone who's overdosed on opioids are finally starting to drop, but meth is more than filling the gap.
It's surpassed what we're seeing from heroin and fentanyl. The rise in meth has just been unbelievable.
Fentanyl, which stops breathing, is still the leading killer in this drug epidemic. A meth-related heart attack or stroke is less common. But some emergency room doctors are seeing more patients arrive with what looks like a stimulant overdose, extreme agitation.
Your heart is racing, your blood pressure is going up, you're probably becoming incredibly sweaty.
Dr. Melissa Liebecker and her staff may have to restrain a patient so they can inject a sedative. For at least 10 years, Liebecker says the stimulant overdoses were rare in her small hospital outside Boston. These days, she sees about 4 a week. Doctors often don't know if a patient is on meth or cocaine or some new stimulant cooked up in a lab outside the U.S. The DEA's second in command for New England, John DeLina, toured a lab last month, deep in a Mexican jungle that the military had just shut down.
A lab that was responsible for the production of up to 7 tons of crystal methamphetamine every 3 days.
7 tons of crystal meth, a solid glass-like form of the drug, could fetch hundreds of millions of dollars.
Those are the drugs that are coming to the United States and ultimately up into our region.
DeLina says the Mexican cartels put almost all U.S. meth producers out of business several years ago with a cheaper, more potent version of the drug. He says cartel leaders figured out that drug users would want an alternative to fentanyl.
They study the trends just like, people here study the stock market, and they know what the next trend is going to be, and sometimes they force that trend upon people, and that's exactly what they're doing in this case.
Meth and other amphetamines have been a tool for people working 2 or 3 jobs for decades. Drug users now may use meth to pick themselves up after being sedated by an opioid. Meth is cheap and delivers a long-lasting high. With meth seizures more than doubling between 2017 and 2018, Boston University epidemiologist Tracy Green sees an urgent need to understand just what's driving meth use.
I think we need to start paying a lot more attention to stimulants, and quickly.
But, says Green, without losing the focus on curbing opioid overdose deaths. For NPR News, I'm Martha Biebinger in Boston.
And now, more from NPR.
Wow.
Live from NPR.
Wow. You know, it's just another drug addiction that America is overwhelmed with. That's all this is really saying. But please tell me what you think, ladies and gentlemen. Please leave your comment and subscribe. Don't forget to hit on the notification bell. And I'll see you on the next video. Peace, family.